Inspection of the respiratory system is the first step in the examination of the lungs. The components can be divided into five, as you can see there. The first being the bony environment of the lung, followed by assessment of the mediastinum, assessment for signs of any volume change, expansion function of the lung, and the status of the skin. The reason bony environment of the lung should be first assessed is because when there is a gross deformity in the bony environment of the lung, then you may not be able to interpret the mediastinal position. For instance, when there is a gross kyphoscoliosis, you may not be able to reliably interpret tracheal position and apical impulse. So the components you need to see in the bony environment of the lung are the shape of the chest, which is seen through the shoulder, symmetry of the chest, sternal deformity like pectus excavatum or pectus carinatum, spinal deformity in the form of kyphosis or scoliosis, and next is the mediastinal position. The tracheal position gives you information about the upper mediastinum, while the apical impulse gives you information about the position of the lower mediastinum. So displacement should be interpreted in the clinical context. Signs of volume change can be either a decrease in the volume or also an increase in the volume. A typical example of condition which causes decrease in the volume is fibrosis. Increase in the volume can be emphysema or even massive pleural effusion. So you need to look at the supra and the infraclavicular fossa for the presence of either hollowness or fullness. Hollowness will indicate a decrease in volume, whereas fullness will increase an increase in the volume. Next will be the drooping of the shoulder, which indicates volume loss. Winging of the scapula, not a very reliable finding because it can also occur in many other conditions. So presence of this could indicate a volume loss. Crowding of ribs indicates a volume loss, and fullness in the intercostal space can be seen in the case of massive pleural effusion. Expansion of the lung should be assessed in the right as well as the left side for symmetry, followed by the skin in the end, where you look for scars, sinuses, and any dilated veins. So following this order of inspection will give you a clear understanding of the findings and to interpret the findings in a proper sequential manner.